So good afternoon, everyone. Dear colleagues, we'll talk about how to arise and answer medical questions with the help of PICO. And we have already heard 11 questions from Peter, but there is one more. What is evidence-based medicine? Evidence-based medicine is the integration of the best research evidence with clinical experience and patient values. Clinicians and patients from a diagnostic and therapeutic alliance which optimize clinical outcome and the quality of life. What is our relationship with EBM? We are also a service provider as a researcher to elaborate. Sorry. So on one hand, we are a service provider as a researcher to elaborate research evidences. And on the other hand, we are users as a clinician to use EBM guidelines to treat our patients. Here is the evidence cycle. And the first step is ask a clear question. We can do it with the help of the PICO, what I'm talking about. The next step is to acquire the evidence from an appropriate source. So, for example, original research studies, systematic reviews. Zsolt Szakács will tell you the details about the searching strategies. With the potential source in hand, we must apprise the evidence to further examine its worth and reliability. We can do it with systematic reviews and meta-analysis. And at the end of the process, there must be a conclusion. So it has to be decided whether it is appropriate to apply in clinical practice or further research or investigation is needed. So as I told you, I was talking about how to ask a question with the help of PICO. There was a nice study in the British Medical Journal, and they tried to collect those questions what we are asking in everyday practice. So you can hear the best 10. You can see here the best 10. Generally, we can say that there is two types of questions. One is the background question, which is concerned on general knowledge. So there is have two parts. A question with who, what, when, where, how, why, and disorder, test, treatment, or other aspects of healthcare. It can be answered by using textbooks or consulting clinical databases. The other question type is the foreground questions, which are specific knowledge questions that affect clinical decisions and include a broad range of biologic, physiologic, and psychological issues, require a research of the primary medical literature, and that are based on PICO. So what is PICO? This is a model, and this is an acronym for Patient Population Problem, Intervention, Prognosis or Exposure, Compare or Comparison with another intervention, and the OS outcome. So here is a question. In a 45-year-old patient with newly diagnosed type 2 diabetes, what is the prognosis as to complications and survival when treated with sulfonylurea and diet as compared to diet alone? So let's check it in PICO format. Patient, the problem is a patient with type 2 diabetes. Intervention is sulfonylurea and diet. Compare with diet alone as a treatment, and outcome is the survivor and the complication. Let's see another question. In a patient with acute appendicitis, how is mortality and morbidity different if the patient is treated with appendectomy as compared with antibiotics alone? So I think it's really easy. Patient is a patient with acute pancreatitis, intervention giving antibiotics, compared to appendectomy, and outcome is morbidity and mortality. we can put two extra questions to the PICO. What type of question are we asking? Are we interested in diagnosis, etiology, therapy, prognosis, or prevention? And what would be the best study design and methodology to use? Why does it matter? There is a table with the different designs. So we can perform PICO about the diagnostic test. There is an example here. So patient with diarrhea, if we measure calprotectin and compare with the colonoscopy, what will be the sensitivity and specificity to diagnose IBD? To address another example, for prognosis, patient with Crohn's disease, compared to those who do not have Crohn's disease, what will be the differences in mortality and morbidity during their life? About the treatment, esophageal bleeding, if we treat it with terlipressin compared to no drugs, what will be the mortality and the need for transfusion? There is another example. This is about the prophylaxis. In angina pectoris, a low-fat diet compared to ordinary food make a difference in mortality and myocardial infarction. And the last example is about the side effects. Patient with the transitory cerebral ischemia, if we give them low-dose aspirin compared to no drugs, what will be the result in GI bleeding. Here in this table you can see that if we are interested in treatment, the best study design to look for, this is the double-blind randomized controlled trials, meta-analysis or systemic reviews. If we're looking for a diagnosis and screening, controlled trial, cross-sectional trials, sensitivity and specificity will be the best to answer our questions. Prognosis and etiology, we can find answers in cohort studies. Quality improvement will be answered by randomized controlled trials, and also for the prevention, the best study design is randomized controlled trial and cohort studies. So why does it matter? It matters because the highest level of evidence that we can expect to find is depend on the type of the question that we are asking. So not only is it important to understand what the level of the study is in order to determine the quality of the research, but it's also important information that can be used for making search strategies, because certain type of research studies lend themselves to certain type of clinical questions. We should keep in mind that the conclusion and the answer to our question has a limitation based on what kind of trial we used to answer our question. So if we use just a retrospective data analysis, the conclusion not be so informative because of the lack of data and because of the missing information. We can have better results if we use prospective registries, but the conclusion what can be drawn is just association between things. Prospective observational trials are good to make causative conclusions, and the prospective controlled trials so we can conclude among two diseases. A randomized double-blind trial can give proper answers for better detailed question in a specific disease, and meta-analysis with the well-structured design, it's able to answer yes or no questions. So the next step in the evidence circle is that acquire the best available evidence, and Zsolt will tell you how to do the literature search. And the next step is price the results conclusion critically and you can use as a method systematic reviews and meta-analysis. But what is meta-analysis? Meta-analysis is a qualitative approach for systematically combining results of previous researches to arrive at conclusions. What does it mean? Quantitative, because we use numbers. Systematic, it has a really structured and strict methodology. Combining, it means synthesize, integrate, and summarize those numbers from previous researches, what have already been done, and the conclusion will be a new knowledge. So a study collects data from individual subjects. A meta-analysis collects data from individual studies. It results in larger sample size, higher statistical power, reflect on real-world practice, allows subgroup analysis and secondary analysis, and it can be done within 6 months with the help of us. So in my presentation, there was some word about the PICO, and the next step will be how to find evidence and how to do the literature search. And to have the potential source in hand, you can perform a systematic review, a systematic review. With the result of that, you can go back to do the basic science researches or clinical studies. And if you have enough data in your hand, you can perform a meta-analysis. And if the data heterogeneity is too high, you can perform a clinical trial to specify the answer on your clinical question. But if you are lucky and you have a homogeneous data set, no more research, you don't have to do more research, and you can go back immediately to the clinical practice to use that evidence you made. And there is an example for how, so it's not just the good clinical question. It is not only important that you have the good clinical question, because here in this comparison you can see on the left-hand side, this is a nice study from excellent Hungarian researchers, and on the right-hand side you can see with the same question the result of the Dutch pancreatic study group. The difference between these two studies was that the Dutch study group, they know the methodology for making a high quality and good evidence to answer their question. And with the same question, just difference between the methodology, the Dutch pancreatic study group can publish their results in the New England Journal of Medicine, and because here in Eastern and Central Europe we are lack of the information and the knowledge about the proper methodology, how to perform a clinical trial and how to perform a meta-analysis. We don't know how to reach our aim. But now here we who are working in the Translational Medicine Institute, we are dedicated to help you and show you the way how can you perform meta-analysis and how can you perform your research and publish, for example, in the New England Journal of Medicine. So in the following presentation, Zsolt will tell you how to do the literature search. Thank you for your attention.